We're back for another episode in this season's Patient No Longer podcast. I have with me a fellow marketing mind, and I'm really excited to get into this one with Jim Nuckols. Jim, thank you for being on.
Glad to be here.
Well, it's a pleasure to be sitting across from you. You are Chief Marketing Officer for Sharp in San Diego, and you've got a great marketing background, going back to General Mills and then getting into healthcare technology and even into provider relationships. And now you've been with Sharp for some time with a little break in there, which I will ask you about. But you and I have gone back quite a bit in talking about the art and science and the challenge of marketing in healthcare specifically. And of course, what we've been marketing and what we believe in for years is this movement around human understanding. So I want a marketer's take. When you hear and see human understanding, and through our partnership with NRC Health, what does human understanding in healthcare mean to you?
So I would say that it's truly understanding what the patient, caregiver, consumer, physician is experiencing and how are they experiencing it, and really trying to understand that in a very visceral way. And this actually goes back to my experience at Hillrom, where I ran marketing and product development. And Hillrom, you may know, has 90% of the hospital bed market.
Yes.
And it's no accident, because what Hillrom did, and I experienced that when I was there, is better than anyone else understood how nurses interact with patients in a bed. And it sounds pretty standard.
Sure.
But we would have nurses, come every week to Batesville, Indiana. And we would work with nurses and watch them, how they interacted with the bed. So all the ergonomics of how do you elevate a patient? How do you keep a patient from falling out of bed? What happens when you put a patient in Trendelenburg? All these little details that actually created a hospital bed that was designed for nurses. So it made their job easier and it didn't hurt them. And the key decision makers in equipping a hospital with beds, usually the chief nursing officer, is very much involved. Right. So we just understood nurses better than anyone else. And guess what? That resulted in a 90% market share of the hospital bed market. So that has influenced me for the rest of my career of the value of really viscerally understanding what your customer is experiencing.
That coming across and almost flipping it in a way, I mean, that is just brilliant that it would be the bed for nurses, because you're thinking of it as a patient bed is for patients. And yet we enter marketing where we think about it from the perspective of, well, who's our audience for this? Who are we trying to appeal to? And that is nurses. I love that, and I love the little details part, which I think we should dig in more, but that was a great response to human understanding. And I know that's a movement that you're a part of and agree with, and it's always interesting to hear the different perspectives. Now, I want to dig into Sharp, because Sharp has been known for some fantastic things, some great marketing. It's a great brand. And of course, there's the Sharp experience. So if people aren't intimately familiar with it, I love the way it phrases, and I'm going to read this off to you and then ask you what it means, you being on the inside. The Sharp experience inspires us to be the best place to work, the best place to practice medicine, and the best place to receive care. Three different things, three different audiences, and yet it coalesces into one brand. So when you talk about Sharp experience or someone asks you what that means, what does it mean to you?
Well, almost everyone in Sharp could recite those three things. Best place to work, best place. In fact, they say best.
Okay.
And what that ultimately results in is we also have a phrase that caps that off. It'd be the best healthcare system in the universe. So,
love that.
But why do you have to be best in all of those? Because they're all interrelated. You are not going to be the best at delivering patient care if you don't have caregivers that feel like they're in a great place. And if you don't have employees, all of the employees that are feeling like this is a great place to be, and I love being here, and it's going to be reflected on how I treat people. So this culture, and when I came to Sharp 10 years ago, I immediately felt it. And there are so many, it actually gets back to little details. And one simple detail. You never point. You lead people to where they need to go. And there's a famous story of our CEO, Mike Murphy, at the time. Someone showed up at our offices. She was about to deliver a baby. And our offices have Sharp on it, but it's not a hospital.
Right.
Mike Murphy led her several miles, followed him in her car to Sharp Mary Birch to
He
deliver a
physically
baby.
did that.
He got in his car and led her to the hospital. So you don't point. You lead people to where they're going to go. And that is for a new employee. I felt that when I first got to Sharp. So those kind of little details illustrate and indicate that you really do care about people and you're understanding what their needs are. You get into a hospital, you're confused. How many
Yes.
people are lost all the time in a hospital? They don't know what to do. They don't know what's next. So instead of pointing, you're leading. So that's an example of how the Sharp experience has to be part of all three of those: the caregiver, the employee, and the patient.
There's several important things you said there, and the first was that employees could recite it, because we know we live in a world where our sort of internal brand or internal marketing, our mission, vision, values, most employees, whether new or old, cannot recite those. Some of those missions are paragraphs. The vision is long, and the values aren't always things that are verbs. You can't always live them out. You've really avoided that. But then the not pointing, I really do like, because it's a leadership technique. It also avoids the blame game of, I pointed to you, I wanted you to do this, you didn't do that. And in patient experience, we know there's so many ways that people can say, well, I took care of my part, you need to do this, you need to do that. How do you pull together as a team? Because in order to do the best place to work, the best place to practice medicine, the best place to receive care, I'll refer to it as best from here on out, as if I'm part of Sharp. In order to do that, that requires incredible internal cooperation. Have you guys struggled with that like other organizations? Have you found ways to work together so that you're not pointing the finger at each other?
More than any other large organization I've been in. I mean, organizations are complicated, and there's silos, and there's lots of things. So I'm not going to say that all of that completely goes away.
That's fair.
But there is an overarching feeling that's it. Sometimes you hear the comment, well, that's not the Sharp way, or that's not how we do it at Sharp, in terms of, those kind of conflicts, that we do want to make this a different kind of place. And it's, part of it is, you have to seat that idea among all employees. We have an extensive employee orientation. We have a lot of training that goes on. This has now been going on for 20 years. So it's a long transformation. We have what we call all staff once a year, where we bring every employee to the convention center. We have 3 sessions of 5,000 apiece, where it's all about the Sharp experience. And it's one part religious revival, one part cheerleading, one part instruction, and one part fun. And I mean, it gets people really excited about Sharp and who we are. It's interesting, during the pandemic, we are going to do our first one here in November in 5 years.
I wondered if that went
It's
away.
really,
was it virtual for a while during the?
we tried virtual, it's just not the same. And
So true.
and we have missed it, and because it was an important injection every year of the all staff isn't the Sharp experience, but it helped communicate the Sharp experience and get people excited about it. So but it takes a lot. It takes constant effort, and we have a team. We have a Sharp experience team. They're continually working on, how do we further the Sharp experience? Where do we need to work on it? How do we need to improve it? And there are many, many layers to it.
It makes the Sharp experience its own sort of almost tangible thing. And I think some of the great brands, and you're a branding and marketing mind, the brand becomes tangible, it becomes palpable. I love your phrase about that's not how we do it at Sharp, which is more powerful and more connecting than just that's not how we do it, which might be a single person's opinion, or one nursing unit does it this way, one other, and it can breed discontent, conflict, or just confusion. I want to ask you one more experience question before we move on, because I really like what you said about the cooperation and what gets pulled together and having a team in front of that. one of our focuses at NRC Health as of late has been really tying together not only patient experience, which has been our passion forever, but the customer experience, the market experience of consumers, which can get left out of that lens, and then the employee experience, which has risen up. It's shot to the top of a lot of CEOs' worry lists because of the Great Resignation. How do you end up tying all of these things together? And are they able to be tied together into a cohesive brand experience? I would put brand experience at the top of all of that, whether I'm employee, customer, whoever I might be, I experience the brand. Is that the way you look at it? And can you really tie those things together?
Obviously, the brand needs to reflect all of that, and
Sure.
all of our advertising and messaging is tied to the Sharp experience. But let me take one aspect of it. You mentioned consumers.
Yes.
And over the last 6 years, we've really had a focus on consumers. And the the phrase that really galvanized it for me is the Sharp experience needs to begin when you Google for care. Because we traditionally we looked at the Sharp experience. Okay, once you get to us, right? But there's so much that happens before you get to us,
Right.
that is complicated, confusing, frustrating, et cetera. So he said, how do we extend the Sharp experience? So the minute I have an owie or a problem, I make it as easy as possible. And there's a lot of talk about the digital front door and those kind of things. It does link to that. So our last 6 years have really been focused on, as a marketer, both to acquire patients and retain patients and make the Sharp experience broader, is how do we address it from that point? So, we have built a digital development team within marketing that is much more like what I had at Hillrom or what I had in my other industry jobs.
Right.
At General Mills. We have a product management discipline. And why is that important? Because a product manager, that's their job. Their job is to understand what is the problem I'm trying to solve, and then I bring all the resources together, and in a disciplined way, I find solutions to those problems. So the problem, when I Google for care is, okay, my son has a sprained ankle. How do I get a dang appointment?
Yes.
How do I get in? That's my
I was
problem.
going to ask you that next.
So,
Yeah.
so we basically built a really compelling digital front door, and we, Get Care Now is what we called it. And so what are my options if something happens like that? Well, how can I easily get an online appointment? How can I get a virtual appointment? Where's the ER? What's the wait time at the ER? What's the wait time at my nearest urgent care? Help me save a spot at my urgent care. So we make all of those as absolutely easy as possible and in one spot that I can go to. And it's been very successful for us.
The direct branding is fantastic. Get Care Now, that's what I'm trying to do. We did a piece of research with consumers, asking them if they had a recent patient experience. When did it start? When did that experience really start? And we haven't talked about this, but what you just reinforced without knowing it is some of the most popular answers were, I sense an issue. I think something might be a little bit off. I don't even know if I have a problem yet, or I have a problem and I'm going and I'm Googling. And these are when the healthcare journey starts according to consumers. It is not
Right.
when I walk in, get wheeled in, whatever it might be. Your point on access is so interesting to me, and I want to draw that together with marketing, because there's been pressure on marketers as of late, and we have a guest, Chris Bevelo, who talks about this. But the pressure is, well, we're full. We shouldn't have to market this service line or that service line because we've got a 6-month wait or an 8-month wait. And I'm sure for Sharp, you've got people wanting to get into that experience that can't be seen today. How do you handle the tension of we're full right now, knowing we also need to market our services and build our brand no matter what?
Well, for sure, we're not going to market aggressively something that has a 6-month wait.
Right.
They obviously have enough volume. But there are consumers that need care.
Yes.
So we have to be able to get them to the place where they can get some care. This honestly is where virtual comes in. we've dramatically expanded our capacity via virtual care, and we have virtual care options that are terrific. The ability to get a same-day appointment with a primary care physician or an APP is crucial, but it may be that your primary care physician is not available. So
Sure.
how do you make it digitally easy to find the next available person? So there's capacity in the system somewhere. It's not always where you want it.
Right.
And there certainly are limits, but we try to get people directed where they at least can get some care. And I'm talking really, in that case, kind of primary,
Of course.
more urgent care. Specialties, I mean, it's a little bit different situation, right?
is.
And we do have to be careful about whether there's capacity, what kind of wait time there is before we're going to invest aggressively in marketing. But that I call it the oh crap moment, and that is something happened. I need to address it. I don't know how. I don't know where I'm going to go. I probably can't see my primary care physician for 2 weeks. I mean,
Yeah.
that is such a quintessential problem point in healthcare
Yes.
that if we can help solve that, and that's where we focused. And I will go back to human understanding, and this is the parallel to the Hillrom experience. We are online. We have most of a day dedicated pretty much every week where we are interviewing. We used to have them come into our offices.
Into your offices, yeah.
But with COVID, we went virtual, and now it's been great. So we're listening to consumers on a variety of questions every week. So this adds up so that we're seeing hundreds of consumers in a year, and we might have a session dedicated to, how are you using the website? What problems do you face when you're making an appointment? Or any kind of question to try to get at what their key needs are. Or even we try out names of things and all sorts of aspects of the consumer experience. So we have a very rich kind of continual flow of consumer input. And when we started this consumer journey, we actually did some anthropological research. We literally went into homes of a representative sample of families in San Diego and did a 2-hour interview in people's homes.
Where they live.
Where they live.
Yes.
And to try to understand, and things that, like what you mentioned about that problem of, when my journey starts, that's such a problem. Where do I go?
Yeah.
That came out loud and clear, as well as many other challenges.
Well, that was a great disassembly of the very obtuse argument of, well, we have enough, we're full. We don't need to market. And I think that as much as we can dispel that across the country because of what you said, and you don't always have capacity where you want, but you have it. And of course, the brand always continues to need to live and breathe. And that gets me into a bit of a futuristic question I want to ask you.
Okay.
And we've had several physicians on this season of Patient No Longer. I've been asking them as a counterpart to this, what is the future role of the physician? Very different answers, very interesting. But I'm curious for you, the deep background, the knowledge, the expertise that you have as a marketer in healthcare. What is the future of the healthcare marketer and perhaps healthcare marketing in general? There's a lot of things changing right now. There's myriad challenges, but what do you see as the future of healthcare marketing?
Personalization is going to be huge, and it's going to take, it does take many forms, but
Yes.
you think of marketing automation where, the EMR, and we recently went to Epic, the EMR triggers who may need what, and we are very much a managed care organization. So we are really looking to manage the health of our patients and, sending triggers to who needs what kind of exams or what kind of follow-up. And then, we use that to communicate out to existing patients. But then also, there's just more and more data out there to really be able to target and personalize our marketing efforts, even in a cookieless world.
Yeah.
We won't be able to do that same kind of
Right.
programmatic and retargeting that you do in the cookie world, but the sources of data become so rich that, I can target pretty darn precisely on who I am trying to reach out to. And I think, who knows where it's going to go with AI and
Of course.
genomics and those kind of things, But I only imagine that's going to get more and more personalized in terms of how we market and how we outreach to patients or potential patients.
Or potential patients too. No, and that's such a clear answer. And I think it speaks to part of what you talked about with the journey, where you've got consumers who don't want to wait till they get in to be considered an individual and be referred to by the doctor or whoever's providing care as themselves. They want to feel that ahead of time. And they want to feel it on the back end too. They want to still be treated as an individual and have personalized care when they're going through recovery and paying the bill and all of those things that continue on in the journey. Speaking of journeys, you've had a very interesting one, and I kind of alluded to this at the beginning, so I will come back. You had a little break from Sharp, and maybe not the sabbatical that most people take in this industry. Can you tell me a little bit about the 2.5 years that you didn't work at Sharp in the last decade?
Yeah, in 2014, after a few years at Sharp and knowing it was my dream job and that's where I wanted to retire, my wife and I were asked by our church, the Church of Jesus Christ of Latter-day Saints, if we would preside over the mission for the church down in the Dominican Republic.
Okay.
For 3 years. It's non-salaried. I mean, it's, and I'm kind of serving as CMO at Sharp, and I remember having the discussion with the CEO and telling him what I was doing, and after he pulled himself off the floor, he said, I don't think I'm going to talk you out of this, Jim. Why am I? I said, no, really not. And so we were down there actually for 3 years, and never came home in all those 3 years, and we're just working with the amazing people of the Dominican Republic, and obviously a level of poverty. I mean, it's it's quasi third world. Certainly parts of it are. And we were working in kind of the poorest parts of the country, and just brought a level of humility, and also I would say, really trying to understand people where they are. You asked the question about human understanding. Well,
Right.
that it changes your perception of actually what it means to be happy, to be honest.
Yeah.
The Dominicans are very poor and incredibly happy.
Wow.
They're just, and so that just gave me a whole different perspective and just helped me look at things differently. 3 years later, I'm having lunch with the CEO, and he says, Jim, do you realize your job's open? And the woman who had replaced me had resigned the month we got back from the DR.
Oh my good, because you weren't expecting to come back you left.
I resigned. It wasn't.
Yeah, someone's got to.
And no one expected me to be back, so I actually walked right back into the same job.
That is so interesting. I mean, and so you've kind of alluded to this with the human perspective, but how was that coming back, and how did that change in your second run versus the first?
Yeah, just a deeper level of empathy and understanding. Also, I just felt that I'd been given this opportunity to be back at Sharp, and I needed to contribute in an important way. And honestly, that is where, for me, where the light bulb went off for me on this consumer focus on their experience. Because interestingly, you said it was curious that at Hillrom we focused on the nurses.
Yes.
Because it's the patient in the bed. Well, on the other end, healthcare has focused so much on how care is delivered and not on the consumer that was kind of a flip in perspective as well.
Yeah.
And I know you were a pioneer in this very thing, and it was a very important change of mindset. And I think actually my experience coming back, having been given kind of a second life,
Right.
I felt like there must be some reason I'm here to do this, and that really became kind of my focus: is how do we become more consumer oriented.
And through such a great, and not intentionally, but through such a fantastic decision and spiritual journey, and something I think a lot of folks are afraid to do. I can't leave my spot. But you went out and you did it. So that was a fantastic answer. I'm going to ask you a much less deep question now,
Okay.
because I'm going to go to our speed round. We're asking everyone the same questions this season, generally speaking. These are fast. They're, top of mind. Don't think too long about it. Quick questions. So I will ask these to you, Jim. Dogs or cats?
Dogs.
Okay. The beach or the mountains?
Ooh,
You have both where you live.
Yeah, see, San Diego, you can surf in the morning and I have done this. I've been at the top of San Gorgonio, 12,000 feet, and been at the beach in the evening.
In the evening,
So-
same day.
Yeah.
We'll give you a both on that.
Yeah,
I don't even
that's
want
both,
you
yeah.
to choose. I just think that's not fair to you. Morning person or night person?
Morning.
Text or call?
Call.
Favorite television show of all time?
Wow.
Everyone gets stumped by this one.
Well, it was kind of a television show, but Band of Brothers.
Band of Brothers was, that's such a great answer.
Yeah.
And then this last one is the biggest softball you'll be asked this month. San Diego or LA?
Are you kidding?
I have to be consistent.
I
Jim.
hope my brother who lives in LA is not listening. He's part of the Chamber of Commerce unofficially, but San Diego is paradise.
Well, I hope he is listening and,
Okay.
create some nice sibling rivalry. Okay, I want to ask you one more question, and you've alluded to this a few times, and it's a passion of mine, and we've known each other for a long time. Consumerism. I've noticed in the temperature of the industry right now that consumerism is something we worried a lot about it before COVID. We had consumer initiatives. We were becoming more consumer-centered. The pandemic hits, and there's a lot of priorities that fall by the wayside, understandably so. And now we're picking it back up. If a listener is out there who's saying, we haven't been focusing enough on the consumer, and we need to either get that back or start doing it, what is just a little bit of advice you'd give them for how to make a few steps towards being more consumer-centered?
Well, you don't have to go very far in your own personal experience to see how consumer-focused things have become. Everything from open table. I mean, think of everything else in your life, dealing with your airline, et cetera. If you don't think that people are experiencing those things and then come to healthcare and feel it being dramatically behind, that's a problem.
It is.
And so the one thing I would say is let that create a sense of urgency with yourself and with your organization. And that is what helped us, is really help physicians and others see, would you book an airline by phone or through a travel agent anymore? I mean,
Feels really wrong to do that
of
now.
course you would not. What do you expect your patients to be thinking and doing? So I think just having that sense of urgency is, and then there's a whole tableau of things, of initiatives that you can do, but
But starting with the personal acknowledgement of,
Yeah.
I've gone through this. I'm a consumer too, and I can't
Right.
leave that out of this
Exactly.
particular movement. I love that. I'm going to stay on the personal level for the last question. I ask
Okay.
this of every guest.
okay.
And you've been in this game and in the healthcare marketing game specifically for a long time, but you get an elevator at Sharp and someone else walks in and it's their first day in healthcare. Day one in healthcare. Short elevator ride. What is a critical piece of advice you would give them on their day one?
Advice, I would say, enjoy this ride, because this is the job that you will have where you will really feel like you're delivering a difference to people. And, your mission isn't a bottom line. Your mission is to serve your community and people in it. And that is a wonderful sense of purpose.
That's a great answer. And that person across from you would actually know the mission because they work at Sharp.
There you go.
I love that work that you've done. I love your take on marketing, and it's just been a pleasure to sit down with you and dig through these things, and we'd love to have you back again to learn more. But for now, thank you so much, Jim.
Great to be here. Thanks for all you do to help healthcare be more consumer focused.
We'll keep going.